Order members, the sitting is resumed and it's time now for questions to the Minister for Health. And can I advise members that question number 4 and 5 have been withdrawn? I call Kiva Archibald.
Margaret, last can call you Kest Ever Hain Hall. Question 1, please.
I thank the member for her question. Provisional absence figures for the period April to August 2021 would suggest that the total absence rates across the HSC are higher this year when compared to the same period in recent years. There are a wide range of reasons, but members will not be surprised to learn that the available data points to mental health as the primary reason for sickness absence in the HSC. Just over 1/3 of hours lost to sick absence is recorded against the mental health category. Whilst mental health is a recognised issue within the population generally, this has been exacerbated by the pandemic, and this is not unexpected due to the nature of HSC work, the physical and emotional demands of the job. I must, as I've repeatedly done so, acknowledge the selflessness, commitment and compassion that our staff have shown throughout this past year. However, I am aware that such commitment and compassion during a challenge period in our history has not come without a cost. HSC staff, first and foremost, are people, and I fully appreciate the challenges associated with the exposure to trauma in the day-to-day work of our health and social care professionals. I also acknowledge their skills developed over long careers with peer support and the mentoring of junior staff as key factors in promoting and maintaining workforce well-being. I remain committed to developing and enhancing psychological and well-being supports for staff and to working alongside the Regional Workforce Wellbeing Network in this aim. However, without sustained long-term investment in workforce growth, safe staffing will not be attainable, and the optimum workforce model as envisaged in the workforce strategy will not be achieved.
I call Kiva Archibald for supplementary.
And I thank the Minister for his response, and I would associate myself with his comments in relation to the commitment and dedication of staff, and also agree with him in relation to the impact, obviously, that the pandemic is having. Minister, we are seeing alarming levels of patients waiting for long periods of time in emergency departments across the north. What interventions has your department put in place to help staff to cope and to reduce waiting times for patients?
And again, I thank the member for her point, and she asked 2 questions there. In regards for the waiting time in regards to patients going into our EDs, we have the no more silos approach. So we have phone first, triaging, and the other aspects that are working there to try to alleviate that pain and pressure that we're currently seeing in our EDs. The member will be, I'm sure, aware that I was joined by the First and Deputy First Minister when we visited the Royal ED last week to see the pressures that are there as well. And the strain and the pressure that is on those staff is also immense, because they're the front line of everybody who is coming forward. The main stress that they are reporting, and it's the same across a number of EDs, is the actual number of beds they're having to manage. So they're near enough managing a ward within the emergency department before they can get patients moved through. So that puts incredible pressure not just on the beds but also on the staff as they try to deal with and triage with emergencies going through that. There are a number of psychological supports across the trust that are across the trust and across the region that are available to all staff, and I would encourage them to make best use of those.
I call Ciara Hunter.
Mr Deputy Speaker, and I'd like to thank the Minister for his answers so far. Minister, we understand the significant pressures that nurses have faced, I suppose, in the last 2 years now, and we welcome any steps to support their mental health. But can I ask the Minister for an update on what strategies his department have in place to improve retention of nurses within our health service? Thank you.
And again, I thank the member for that. The member may be aware that I announced last week, in working with the Chief Nursing Officer, a specific task force actually to look at nursing retention in our nursing and midwifery working group, because that is a specific target set, a specific skill set that we do not just need to recruit but also retain. Up until that point, recruitment and retention had been looked at as one strategy, but I asked the Chief Nursing Officer, in conjunction with our trade unions as well, to look at what can be done to retain our nurses in that workforce, taking into consideration the pressures they are under, the supports that they need, but also recognising the vital part that they are to our health and social care workforce.
I call Alan Chambers.
Deputy Speaker, and thank the Minister for his answers so far. Can the Minister provide an update on the £15 million he allocated to trusts earlier this year to support healthcare workers across Northern Ireland?
Again, I thank the member. As he states, I did provide £15 million of additional funding split evenly between the 5 main trusts, and that was to be used to provide support for our HSC staff. As our HSC retains a number of separate and distinct charitable funds across the health estate, and it actually covers a multitude of themes and locations. These funds in themselves are an important role in providing services, training and support that cannot be ordinarily funded using public funding, and have made a very significant contribution to the healthcare in Northern Ireland. They have contributed to the health sector for a number of years, actually relying on the general public's goodwill alone. So in order to supplement the work of these funds going forward and to further support staff as we move out of the pandemic, I therefore seen a distribution to be split evenly between the 5 main trusts to be used specifically to provide support to staff. Because as we know, the COVID-19 pandemic has had a major impact on all corners of life, on all ages and on all professions, but none more so than our health and social care workers in the context of the major pressures that are remaining across our HSE system and significant workforce pressures. So adequately supporting those workers is more important than ever before, and that's why I utilised that £15 million across all 5 trusts split evenly.
Moving on, I call Sinead Ennis.
Question 2, please.
Again, I thank the member, and this is an issue that has been raised within this Parliament and also the Pensioners Parliament as well. In June 2021, I announced that the Public Health Agency had been tasked with a review of adult centres, short breaks and transport. The aim of this review is to identify a safe pathway to restoring services to pre-pandemic levels. So a multi-agency task force was established to convene key stakeholders from health trusts, the Health and Social Care Board, PHA and the Department. Aligned to this, the Patient Client Council established an engagement panel with families of people with learning disabilities to ensure that the voices of carers informed the guided pathway to restore services. A number of carers were invited to join the task force to ensure that their views were considered equally to those of practitioners and policy makers. So a significant exercise has been undertaken to assess the current level of service provision, the implementation of infection and prevention control guidance, vaccination uptake, routine testing of participation, and ultimately the risk associated with the increased service provision. Additionally, the Patient Client Council conducted a survey of approximately 100 families to understand views towards the restoration of services. Families are clear that they seek a full restoration of adult centres, short breaks and transports, but underpinned by good infection control practice, high levels of vaccination and routine staff and client testing. And I very much want to see full restoration of respite services to give those carers a much-needed break. The review has entered its final stage and is due to submit a final report in the coming days for departmental consideration.
I call Sinead Ennis.
I thank the Minister for his response, and I'm glad to see him reiterate his commitment to the restoration of full access to services, because, Minister, I've been dealing with a number of families across Southdown, families and carers who've been struggling since the start of the pandemic, and they're still struggling today without the restoration of those full respite and adult daycare services. So I know you've said that it's expected to report within the next few days. I wonder, will the Minister use this as an opportunity to ensure that how best he can expand those services to make sure that there definitely is a return to full access and full-time access to those respite and adult daycare services?
No, and I thank the member for that point, because I'm acutely aware that the reduced provision of adult daycare and short breaks has placed that significant burden on our carers over the past 18 months. And I would like to extend my gratitude to families for the role they have played in keeping their loved ones safe and responding to the emerging needs that have arose from the pandemic. I'm aware that trusts are at varying levels of service provision, reflective of the availability of physical space and the use of independent sector contracts. My Chief Social Work Officer tasks trusts to review those rebuilding plans with a review of replicating effective practice across all the trust areas. So our health trusts are also exploring a range of options to further increase the level and the range of services provided, and that includes the increased use of day opportunities to also provide a meaningful outlet for people with disabilities.
I call Dolores Kelly.
Speaker, as a former daycare manager, it is not always about respite services. Of course, it's about rehabilitation and improving the quality of life and opportunities for those who attend. But, Minister, you did refer to different trusts have different standards, if you like, in terms of the restoration of services. I wonder, could you seek to ensure that there's not a postcode lottery for both clients and indeed their families, and that I know that the Southern Trust had a review out, and there was some concern that actually that would have led to a reduction of service provision. But post-COVID, surely the demand will be much greater, and how is that being taken account of?
Can I remind members to be succinct with their question, Minister?
I thank the member for her statement. But in regards to the point, and it is a point that is well made, and she's often heard me from this place saying that I want to see a regional service, not that postcode provision. So part of this work and review of the provision of our daycare services isn't just about rebuilding what we had, but seeing what more we can do and making sure it is consistent across all our trusts. And that's why my Chief Social Work Officer has made sure that those other bodies are engaged, from our health trusts, the Health and Social Care Board, the Public Health Agency, the Department, but also those users as well, which includes family members and stakeholders that actually use the services as well, so they've got an input into how this review and actually what it comes out, rather than just being an exercise of starting or finishing off where we started, rather than taking this opportunity actually to improve that provision.
I call Rosemary Barton.
Thank you, Minister, for your answers so far. Can the Minister provide any clarity on the level of vaccination uptake in the service users and the staff in such facilities?
I thank the member for her point, because I know that is something that was actually raised by a member in here, I think last week or the week before. The PHA has undertaken a review of vaccination uptake in adult centres, short breaks and transport, and I'm pleased to report that there has been a high level of vaccination across service users and staff, which provides a strong platform to further increase service provision. Options are in development to introduce routine testing for service users, and that will further mitigate COVID-19 risk and actually increase service provision. This will also complement the existing routine testing programme for health and social care staff, because families have expressed concerns over potential service user testing, which are being further explored. But recognising that some individuals may be unable to avail of the vaccination or be able to participate in testing, I can confirm that no one will be denied a health and social care service as a result.
I call Stuart Dixon.
Thank you, Minister. When we think about respite care services, can you recognise the exhaustion that families and others who care every day are in because those services are not available or are so limited? Minister, when you say review, we hear review from you on many occasions, but when will this review turn into action?
I thank the member, and when he does hear review from me many times, it is because there is work ongoing and delivery being done, and the member will know that in regards to what has been delivered over the past 18 months from my department and the people working across the health and social care sector. In regards to review of the current provision that we have, often what is asked in here is often what is asked of me is what engagement there has been with the stakeholders. So in regards to this review, I made it clear, and again I engaged the Patient Client Council, and they set up an engagement panel of 20 carers. That was established and has met 5 times since the beginning of August in regards to the review of the provision of what we can bring back and how we'll bring it back. And additionally, the Patient Client Council actually conducted an online survey throughout the month of August to provide families with the opportunity to shape the restoration of our services. So carers have responded positively to the draft framework, although they have raised some concerns, and that's some concerns and proposals to introduce service user testing, which will require further consideration. So my departmental officials have been assured that the framework will be submitted for my consideration shortly to do that, but it's making sure that that service that comes back actually meets the needs of the people that's using it, rather than something that either departmental officials, trust officials or PHA thinks meets the specification that they think it should.
Moving on, I call Philip McGuigan.
Ever a tree, question number 3.
Mr. Speaker, with Deputy Speaker, with your indulgence, I'll join question 3 with question 13, and if I could ask for additional time. Members will be aware in January announced a special recognition payment of £500 will be made to Northern Ireland's health and social care workers. Payment to the statutory sector employees commenced in July. An additional letter was issued to care home, domiciliary care and supported living providers in May, advising that work on eligibility and the mechanisms for processing payment was ongoing and that further information would be provided. A further letter has been issued in August providing an update. Work to deliver this payment to staff in the independent sector has proven to be complex and challenging. Unlike the statutory sector payments whereby my officials were working with a small number of employers, the independent sector has a larger number employer base. In addition, workers within the independent sector are much more transient than the statutory sector, and developing a set of standardised eligibility criteria has proven more challenging. Likewise, the development of a payment mechanism, particularly in circumstances where an employee has moved between providers or has moved out of the sector completely, has proven problematic. My officials continue to engage with the trade unions and the representatives of employers to develop a workable payment process. Whilst this has taken longer than for staff working in the Health and Social Care Trust, that does not reflect any difference in value of the work done. I am not, however, able to be definite about a timescale for delivery of these payments, nor do I want to provide an artificial expectation by being pushed into providing an exact date of these payments. But what I can assure members, and more importantly, those working in the sector, is that my officials are actively engaging in trying to resolve these outstanding issues without any further undue delay. Officials have in recent days had further detailed discussions with trusts, the Health and Social Care Board and the Business Services Organisation about the next steps in progressing this payment. Meetings will continue on a weekly basis to ensure that these issues are resolved, because I remain personally committed to ensuring the recognition payment will be paid to the independent sector staff as soon as is practicable.
I call Philip McGuigan for supplementary.
And Minister, you used the word challenging a number of times in your initial response, and I accept that, but I mean, you also need to accept that it's been over 8 months since the COVID recognition payment was announced, and many staff, particularly in the independent sector, are currently in a state of limbo. I mean, I, like probably every other MLA in this House, is receiving a message daily asking for an update on this. You said you can provide a date. I think that's
Can we have a question, please?
I would like you here today to provide clarity that the independent sector will receive this payment and a date and time scale for that payment.
And again, I thank the member, and I can assure him I received those emails as well, because it was me who made the commitment. I have the money there, my dedication is there, and also that of my officials. I'm not able to provide a date or time as much as I would like to, but I can assure the member that, as I said, the trusts, the Health and Social Care Board and the Business Service Organisations are now meeting weekly to ensure that these issues are resolved, and we continue to engage with the employers and also trade unions and those who are represented by trade unions in the sector to make sure that we can get this payment rolled out as effectively and as efficiently and as soon as is possible.
I call Diane Dawes for supplementary.
Can I thank the Minister for his answer? I think, like most people and those who work in the independent sector, will be disappointed by what the Minister has to say today. I spoke to the Finance Minister in this House yesterday, and he said that there was an indication that the payment should go out this autumn.
Can we have a question, please? This is question time.
Sorry,
question, please.
Is this correct? And if it is not correct, what does this say about the value we place on these workers who perform a crucial job?
And I thank the member, because when I first brought this issue to the executive, she was one of the supporting ministers, not just to ensure that the money was there, but the additional monies were there so that the national insurance wasn't taken out as well. It doesn't and it shouldn't take away from the value that we place on those in the independent sector. As I said, it is proven more problematic than simply paying those who work in our Health and Social Care Trust because of the small number of employers. The dedication is there, the commitment is there, and as the member knows, the money is there to make these payments. It's just how we get the process to make sure that it is auditable, it is accountable, because after all, it still is public money that we are accountable for.
I call Jerry Carroll.
Minister, I'd like to ask your view on those workers not directly employed by the Trust or the Department, but who provided essential health work during the pandemic. One of the groups, BFAST, delivered medical equipment across our communities. I think you met them during the pandemic as well. Minister, are these workers deserving of a special recognition payment, and what steps have been taken to ensure that they get one? Thank you.
I thank the member. In regards to the eligibility criteria that was set out, to be entitled to receive the payment, staff must have worked in an organisation registered with the RQIA and hold a contract with the Health and Social Care Trust or the Health and Social Care Board for the provision of adult social care or a children's residential care service. But in addition, staff working in an organisation with a contract with the Health and Social Care Trust for providing day opportunities will also be eligible, and staff who have worked at least 1 month's continuous service between the 17th of March and the 31st of July. Staff employed on a part-time basis will receive a pro-rata payment, but if the member wants to send me the exact details of the organisation and the individuals, I'll get back to him with clarity on that.
I call Colin McGrath.
And can I welcome what the Minister has said today, and I'm sure those words will be of comfort to people in the independent sector that the payments will come. It will just be about when. But given the number of members that have spoken about this today, would the Minister undertake to write to members to detail what will be happening? Because often in the independent sector they aren't part of unions, they aren't getting the information, and that's why they're coming to MLAs. But if there was a standardised letter from the Minister that we could distribute to our constituents, that would give them great comfort.
I thank the member for his point, and I think I've answered many questions in regards to the frequently asked questions and answers that we have on the departmental website. As our weekly meetings progress and as we get more movement, those frequently answered questions are updated. But, Mr. Speaker, I think just to place on record that the independent sector is valuable. This payment is for what it should be, and that's in recognition of the workforce that we have there. To date, of the health and social care workforce, we've paid or made payments to over 83,000 people, to a total of £55.463 million have been paid to workers within the HSC system. As I say, that was a complicated process, but it was simpler than what we have to do in the independent sector as well. But the dedication there, the commitments there, and the support is there for those workers, so they are acknowledged as well.
And I call Paula Bradshaw.
Speaker, and thank you, Minister, for your answer so far. My question is in relation to the removal of the free car parking for the health and social care staff who are based in some of our hospitals. Minister,
can I remind the member that she is straying from the original question?
I'll be brief. Minister, are you satisfied that the trusts have explored everything they can to raise that revenue in other ways, so that these charges
the Minister may or may not wish to answer the question.
Don't have to be reintroduced.
Minister.
Thank you.
I thank the member for her point. Although not connected, she will be aware that we did supplement car parking charges for a considerable period of time. Not every trust applies the same criteria or charging facility or charging mechanism across Northern Ireland, but I am aware that those trusts who have reintroduced some level of charging to their staff are trying to put in provisions for park and ride and put in place alternatives rather than simply look to fundraising the gap that's there. Part of the challenge that we've had, and I've had conversation with trusts, as regard to the lack of parking facilities on some of our hospital sites. So where we've used those parking facilities for staff and we're able to support them through that, it negates then the number of parking spaces that are available then for either patients, those coming in for day procedures, or those coming in to visit as well, which leads to some of the long queues and actually some missed appointments because people are waiting so long in a car parking space that they don't get in to get their procedure that they've actually been attending hospital for.
Moving on, I call Maurice Bradley.
Thank you, Mr. Deputy Speaker. Question 6.
I thank the member for his question, and I'll join question 6 and question 10 together. And again, if I can ask for additional time. I recognise how important it is that people can access GP services when they need to do so. I want to stress again that GP practices are open and will continue to provide both face-to-face appointments and alternative consultation options for patients as appropriate. Even prior to the COVID-19 pandemic, primary care services were coming under increased pressure. Figures in 2019 indicated patient contacts were almost 15 million per year, and that was up from an estimated 12.7 in 2014. At the same time, GP workforce, as measured in whole-time equivalents, has decreased by 8%. The pandemic has accelerated a trend that was already underway to make greater use of technology to help manage the increase in demand in primary care. General practice telephone first consultation allows patients to seek timely medical advice from their GP. The GP decides how best to meet the need of the patient. Where a face-to-face appointment is appropriate, that will then be arranged. This approach has enabled GPs to appropriately manage, treat and support a greater number of people than would otherwise have been the case. Recent figures indicate that currently approximately 147,000 GP and practice nurse consultations are taking place on a weekly basis. Feedback from GPs indicate that many patients are presenting with more complex needs, particularly those who have a chronic disease, making it more difficult for them to see all the patients that they would wish to. I'm aware that some patients are experiencing difficulty in accessing their GP by telephone, and I understand their frustration where this is the case, and I also share the concerns that this causes. Work is underway on a number of fronts to help improve access to primary care services for patients. My department has invested £1.7 million to upgrade GP telephony services and to improve telephone access. Further urgent work is progressing with GPs and the Health and Social Care Board to explore how telephony can be better used to support the service. Consideration is also being given to ways to better deal with routine requests such as repeat prescriptions actually to release capacity. At the same time, work is well advanced on a review of GP trainee places to make sure we have enough GPs to meet our primary care needs in the future. It is anticipated that this will be completed in the autumn as well. This work that is already underway is part of a wider programme of work to help improve patient access to services in primary care, and that includes the wider rollout of primary care MDTs and work to reform the out-of-hours service. Finally, I would reiterate that if people have symptoms or an unexplained illness or have any reason to be concerned, they should in the first instance contact their GP, who will be able to provide advice. GPs want anyone who has a health concern to feel reassured that they will be able to get an appointment and see a GP if necessary.
I call Morris Bradley for supplementary.
Thank you, Mr Deputy Speaker. Thank you, Minister, for that very detailed answer. But, Minister, it would be wrong to label all GP practices generally, as there are some excellent, as you have said, operating exceptionally well during this pandemic, but there are some who are not. What additional stress is the lack of GP surgery appointment availability having on our NHS? And what additional stress has limited home visits by doctor on call had on the NHS and the excellent staff at all levels who are feeling that stress?
And I think that the member for his comments, and I think he initially points out the challenges we have, because we have GPs across the country who are providing an excellent service over and above manning out of hours, manning COVID centres, and looking after their own practice as well. But also, like many others, there are those who present challenges to the reputation of an excellent workforce as well. So the additional strains and stresses are not just felt within the GP practices in regards to how they are being perceived or being portrayed as a whole, which is often unfair, but it also is adding additional strains and stresses to our ED departments and other parts of our hospital services as well. So when it comes to the work of no more silos in regards to the out-of-hours telephone and call first rather than going to the ED directly as well, there are steps that I would encourage patients to take rather than just simply turning up to the ED, but also if they do need to see their GP, that they do make access to do that. But also the GPs do take the support mechanisms that are coming forward from my department and the Health and Social Care Board in regards to updating telephone services, fully automating repeat prescriptions as much as possible to make sure that those additional pressures and time commitments are taken off and alleviated from the work they're continuing trying to do.
I call Paula Bradley.
Can I thank the Minister for his answer? Ministers, it has been well rehearsed that a lack of GP face-to-face services could lead to an increase in certain diseases and illnesses. I just want to ask around those of an age group who are maybe in early stage dementia and things like that. How do we alleviate the anxiety that those families and those patients feel not being able to get in to see the doctor that knows them best?
And I thank the member for that point. In regards, there's a number of avenues there, but I think the crucial point of her statement is actually in the last line, is those GPs who know the patient best. And many of those GPs, when the son, the daughter, the care call in regards to someone who is suffering from dementia or has those additional medical needs, the GP will be able to triage them, as will the GP's receptionist, because they are known to the service. And I think that is one of the strengths of our GP fraternity, that we often underestimate in regards to how much they actually know their patients and their clientele as well. But it is important that anybody who needs to see a GP actually gets to see them. It's not easy. But one thing we need to be clear of as well, this isn't just a post-COVID or during a COVID problem as well. Pre-COVID, we still had the same challenges because of a reduced workforce within our GP practices and a high demand for the services that they actually provided. So that's why we rolled out initiatives like the multidisciplinary team, where individuals within a practice and healthcare professionals could see a wide range of patients in different settings, and not everybody had to go and see the GP in the first instance.
That ends the period of time indicated for listed questions, and now we move on to topical questions, and we'll have 15 minutes. Can I advise members that questions number 6, 8 and 9 have been withdrawn? I call Declan McAleer.
The Minister will be aware that it takes 8 years for the condition of endometriosis to be diagnosed. And in the words of a lady who contacted me with this condition, she says, that's 8 years of truly horrific pain, 8 years of disease growth and 8 years of mental anguish. Can the Minister tell me what steps are being taken to ensure that women who have this endometriosis are receiving adequate care and support whilst they await specialist consultation, and can give assurances that GPs will be adequately supported and resourced to provide the best possible frontline service for people who have this condition? Thank you.
And I thank the member for his question, because I know it is something he's corresponded with me on. Firstly, I want to say that I receive, again, not just correspondence from the member, but also a lot of correspondence on this issue of endometriosis treatment and diagnosis. And I'm very aware of the considerable pain this condition can cause to women who suffer from it. As patient demand for elective care services currently exceeds funded health service capacity for both new outpatients and inpatient day case treatment across a range of specialties, and that includes gynaecology. Regrettably, it is inevitable that waiting times will increase, as has been seen over the last few years. Endometriosis services are provided as a subspecialty within gynaecology, and the Health and Social Care Board is responsible for ensuring that the NICE guideline on the diagnosis and treatment of endometriosis, which has been endorsed by the Department in October 2017, is cascaded and embedded in the health and social care system. So a patient with endometriosis will receive support from GPs to manage the condition until they are seen by a gynaecologist. If their condition worsens, then they are urgently referred to secondary care. There are no specific endometriosis services within the Northern and Southern Trusts areas, and there is a limited service within the South Eastern. Patients in these areas are usually referred to services within the Belfast and Western Trusts. There is also a small business research initiative being led by the PHA to develop a digital platform to support people living with chronic pain in Northern Ireland, and that will include women with endometriosis. While it is still expected to take some time before this platform is available, I appreciate that this is not therefore available to anyone in the immediate future. I hope it nonetheless provides further reassurances that people suffering from chronic pain from conditions such as endometriosis are not being ignored or forgotten, and plans have been put and are being put in place to help them.
I call Declan McAleer.
Thank the Minister for his response. And would the Minister join with me in commending the excellent work of charities such as Endometriosis UK? And I want to mention in particular Lorraine Agnew, who's an endless campaigner and has been living with this condition for 20 years. And indeed, her brother Cormac, he is completing a full-distance Ironman challenge, Ironman for Endo, for Endometriosis UK charity on the 23rd of October.
I will, and again, I think since coming into this position, the work of our advocates and the voluntary and community sector in regards to supporting the work that healthcare does should not be underestimated, and I congratulate and I wish well the gentleman as he undertakes that fundraising exercise in regards to that, and also wish his sister well, as seeking and getting the help and support that she needs.
I call Pat Cackney.
Mr Deputy Speaker. Minister, the warnings raised by yourself in relation to the impact of COVID transmission and winter pressures this week were stark, and I know no one who will want to see those come to fruition. So, Minister, for avoidance of doubt, can I ask if you agree with the SDLP proposal for vaccine certification for entertainment and hospitality venues underpinned in the COVID regulations?
I thank the member for his question, but I need to be clear that the vote that was taken last night was on a scheme that we don't have, on a sector that is actually willing to introduce it on a voluntarily system. So they are more than willing to actually do it. So in regards to what was actually done last night, it doesn't reiterate in regards to my position on the development and implementation of a vaccine certification programme. I've been clear since 22nd of April, where I actually asked the executive colleagues to bring forward a proposal so that if we ever should need to utilise a COVID domestic certification system, that we would have one in place. We are still waiting on that conversation and that discussion to be had at the executive level. But I'll also say I welcome those parties who have joined me in the last week and actually seeking to develop a COVID certification scheme, so that should we need it here in Northern Ireland, we have one ready to deploy and utilise, but also that we don't detract from the people in Northern Ireland who have been vaccinated, who want to avail of systems or venues or sporting events or entertainment events in England, Scotland, Wales or the Republic of Ireland, should such a scheme be necessary, because I think that's a vital scheme that we should be doing.
I call Pat Cackney for supplementary.
Sir, I thank you for your reply, and I just hope that you had brought that last night to that executive meeting, which wasn't there. I have to say that I was extremely disappointed, Minister, by the statement issued in your name today, which appears to me to question the sincerity of my party on this issue. And you may want to take this opportunity to reconsider your comments. In response to a written question on the 5th of July, the Minister said his department estimated 10.5 million was needed for, among other things.
Have we a question?
I have a question.
Can I have it, please?
Yeah, you're having it, sir. Was needed for, among other things.
Order.
You're having your question.
Order. Just to remind members, question time is an opportunity for a brief introduction and then a question. Please ask your question.
Thank you, Mr. Deputy Speaker. So, the Department estimated 10.5 million, Minister, was needed for, among other things, features to support an executive policy on domestic use of the COVID passport. Can you provide an update on work that has taken place over the last 3 months?
And again, I thank the member. I'm not sure where his anger comes from. But I will say, when I saw some commentary last night, it reminded me of a line from a poem. Yesterday upon a stair, I met a man who wasn't there.
Order! This is question time, and there are no points of orders during question time. A question has been asked, and a question has been asked, and the Minister now has an opportunity to answer. There's an opportunity to ask points of orders after question time. Minister.
And there has been a lot of commentary in regards, both from politicians and both from the media, who seem to be informed of discussions and other things that took place that didn't reflect or actually correspond to any meeting that I was at. The member asked in specific to the value that was placed to introduce a domestic vaccine certification system. That is correct. The policy lead for the introduction of that certificate lies with the Executive Office. Until I get a policy direction or the Executive agrees on a policy to actually develop that domestic certification scheme, should it be for use here in Northern Ireland, or should it to be allow those people in Northern Ireland who have been vaccinated to access facilities, sporting events or recreational events in England, Scotland, Wales or the Republic of Ireland, I cannot proceed and will not proceed in the expense of over £10 million in developing one that I don't have executive support in actually doing so.
I call it Maurice Brandley.
Thank you, Mr. Deputy Speaker. Can I ask the Minister for his assessment of the current provision of dentists providing NHS treatment I'm sure other members would have similar concerns, but it is in relation to constituents who have been in contact complaining they cannot see a dentist as an NHS patient unless in an emergency. But the same practice will be willing to take that appointment and offer an appointment if the constituent were to pay for the treatment.
I thank the member, and again, like the question he raised in regards to GPs, the pressures that have been put on our dentists across the health and social care system have been repeated as well. We have put in a number of support mechanisms to support those NHS practices to maintain that level of work and support that they do need to provide, should that be from financial support to PPE provision, or also additional monies that was actually supplied at the start of this year in regards to putting in additional ventilation systems as well. So again, we have always had a struggle with NHS patients regarding access to dentists in regards to the number of dental practices that we do. I recently met our interim chief dental officer to see what more we could do as a department, as in the Health and Social Care Board, to actually encourage more people coming into the profession, that our dentists as well expand the provision and the service they do in regards to NHS patients as well, should that be in their younger age cohorts or our older age cohorts as well, because it's a vital service that they provide as part of our healthcare family. And as dentists, I think the importance is that dentists aren't just about teeth. They're about checking the mouth, they're about checking for oral cancers, and they do so much as well, and that's why they're even included. Our dentists are also included in our cancer strategy as well, as to the vital role and input that they can play there as well.
I call Maurice Bradley for supplementary.
Mr Deputy Speaker, and I thank the Minister for that answer. But Minister, have dentists and dental practitioners been overlooked, particularly since commitment payments were removed almost a decade ago, leading to a reduction in income of some £12,000, and nothing has been put in place since? Is it a case that to survive, dental practices are being forced down a private care route at the expense of NHS patients?
I thank the member, but maybe just to update, general dental services have actually received an additional £13.9 million in funding for PPE alone since April 2020. There's also the FSS and PPE support that has been introduced, and it has been projected that an estimated £4.3 million will be provided to dentists specifically for level 2 PPE for the remainder of this month as well. So there are additional financial supports that have been put into dental practices over the last 18 months as well, to make sure that they could continue to see patients as well and perform the work that they actually do.
I call Alan Chambers.
Deputy Speaker, could the Minister give me an update on his efforts to secure the additional funding he will require to deliver the proposed 3% pay offer to health workers?
As the member will be aware, the NHS pay review body and the review body for doctors and dentists remuneration both reported and recommended a 3% uplift in the salaries of relevant staff from April of this year. I am fully supportive of the recommended approach for our health and social care workforce, and see an early announcement of an acceptance of the recommendations as a small measure of our collective gratitude. As I'm sure all in this House will agree, in recent years, these staff have faced unacceptable delays in the implementation of pay awards. This is something we cannot be seen to permit to reoccur this year. So while my department had included initial budgetary cover for HSC pay awards of 2%, implementation of the increased recommendation of the review bodies, coupled with a higher baseline pay bill across the year following increased activity, I will require further additional funding, and that is why on the 22nd of July I wrote to the Finance Minister seeking funding, and recently I have again submitted a formal bid for pay pressures in the upcoming October monitoring round of an additional £70 million, and as I stand I am currently waiting for a decision.
Call Alan Chambers for supplementary.
I thank the Minister for that. Would the Minister be surprised that a proposal that was defeated by 7 votes to 1 was placed before the Health Committee recently by the People Before Profit representative on the committee, urging the Minister and the First and Deputy First Ministers not to implement the planned offer of 3% for health workers in order to supposedly find additional money from elsewhere?
I will be surprised to hear that, and I can assure the member that the 3% was what was recommended by the independent review body. As I say, I'm still waiting support from my executive colleagues to be able to make that as a formal pay offer, so that that can actually be put in place for the trade unions to consider as well. But I would rather go forward and pay the 3% that I have in hand at that point than wait on any additional potential funding coming from elsewhere.
Could we have Daniel McCrossan onto the screen, and we have an opportunity for a brief question. I call Daniel McCrossan.
Thank you, Mr Deputy Speaker. Minister, can you give an assurance to the House that the latest changes to contact tracing, contact and testing in schools still maintains the maximum degree of safety to our children and staff in schools, especially those who are CEV and CV?
I thank the member for this, and I know it's something he's raised at the Education Committee as well. Apart from the side of meeting the bun, I think it was a good engagement that he had with the Chief Medical Officer and the Education Minister. Contact tracing performance of school-aged children remains very good, with almost all school-aged cases being completed within 24 hours. The latest performance as of the 26th of September at 4:30, with contact tracing still continuing at 8 p.m. that evening. 429 positive cases received, 383 were successfully completed. Fewer calls have been escalated to the PHA Education Cell, and actually none were escalated by Education Authority over the weekend, Saturday the 27th and Sunday the 28th of September. So PHA Contact Tracing Service continue to proactively identify schools with a high number of cases, and are proactively contacting those schools to provide appropriate assistance and guidance, and these processes continue to bed in. At the 27th of September, PHA Education Cell are actively following up on 10 schools, most of which are special schools, where this is an arrangement to follow up on every case that exists. A small number are clusters. Wider testing has been recommended in a number of schools, and PHA has worked directly with these schools to manage the situation. And my officials in PHA continue to work closely with the Minister of Education, the Department of Education and the Education Authority to embed these new processes.
And that is the end of our period of time of questions to the Minister for Health. I advise members to take their ease for a few moments for our next item of business, which is an urgent oral question to the Minister for Education.